Welcome to the second part of BW Digest, where we talk about Indian students in Ukraine. In the last episode, we discussed कि कैसे high medical cost and less availability of government seats in this country force many students, especially from middle class families, to go to countries like Ukraine, Russia, Belarus, Poland, etc. to gain medical education. हिंदुस्तान में हर साल NEET का एग्जाम 16 लाख बच्चे देते हैं, जिसमें से 8 लाख उसे क्वालिफाई कर पाते हैं. अब इन 8 लाख में से 88,000, which means 88,000 seats are only reserved for the government quota. Now this is the story of undergraduate. When it comes to postgraduate, less than 55,000 seats are available in government quota. Where does this lead to? Very few available government seats, जिसकी of course मान्यता हमारे देश में ज़्यादा होती है. अगर आपको government seats नहीं मिलती हैं, तो private education cost in this country ranges from 25 lakhs to 1.5 crores. We spoke to two senior medical practitioners in this country. Listen in very carefully to what they have to say.
There are 16 lakh students appearing for NEET examination. Out of that, around 80,000 are getting seats whether in government or private medical college. Balance students are trying for international degree. You see, be it in Ukraine, Belarus, Russia, and other countries. In India, private education, medical education is quite high. The fees is around 14 lakh to 20 lakh rupee per annum. Whereas in all these countries, the fees is around 2 lakh to 4 lakh rupee per annum. So fees is quite low in this country, and that's why these are the most favored destination for Indian students. However, while coming back, these students to appear for another examination called FMG examination, and once they clear it, then only they can practice in India. However, success rate is only 10%.
While in Ukraine, the education fees per year is approximately half of the Indian fees, and the standards are also good, and their degree is also recognized by all the international accreditation boards. So there is a big question mark on Indian medical education, especially in private medical colleges. All the authorities who are concerned about this should be doing something to prevent this happening in the future.
We need to do something about it. Narendra Modi, the Honorable Prime Minister, recently highlighted that why so many Indian students leave the country to pursue medical education. Of course, we need to prevent this. But how do we do that? In countries like US and UK, health expenditure as a percentage of GDP is close to 12%. India is somewhere between the range of 2.5 to 3%, in spite of the fact that we do not have sufficient doctors in this country. WHO guidelines says that there should be one doctor per 1,000 people. In India, it's close to 1,500. 1500 लोगों पे एक डॉक्टर. इसके सॉल्यूशंस क्या हैं? क्या मेडिकल काउंसिल ऑफ इंडिया को इसका नजरअंदाज करना अब राज देगा? Can India come up with public-private models of opening medical colleges? In India, every college has a hospital as well, where it's affiliated to. That takes the cost exorbitantly high. Should the government and the Medical Council of India come up with more models of hospitals and colleges in a public-private partnership? You know, where does all this lead to? हम सब victim रहे हैं high exorbitant cost of hospitals के जब हम अपने patient को लेकर के जाते हैं, especially अगर आपका health insurance नहीं हो. The costs are so exorbitantly high that most of us cannot even afford it. और इसका core reason supply side की तरफ है. जब supply side में capitation fees medical colleges इतनी ज़्यादा charge करेंगे, तो बच्चे कहाँ से पैसे निकालेंगे? This is in spite of the fact that India does not even have very good doctors, apart leaving the few of them. Dr. Devi Shetty highlighted this very clearly. He said that India mein medical education is a subject of elitist, which means that if you have money in your pocket, only then can you afford medical education. We need to make medical education affordable for students in this country so that we do not have a brain drain. It's vital for the health and healthy ecosystem of our economy. Please let us know, what do you think? And are there any reforms you have in mind to be proposed to the government? Stay tuned for more episodes of BW Digest.